Good afternoon, ladies and gentlemen. My presentation is on factors affecting early antenatal booking. Introduction. Very little is known about effectiveness of early antenatal care for maternal health. This is evident in lack of information on etiology, pathogenesis and natural history of some conditions like hypertension, which causes maternal mortality and morbidity in developing countries. Findings of this study will help to intensify health education, correct negative attitudes, and help to create awareness on the importance of early antenatal clinic, which will reduce maternal and fetal newborn morbidity and mortality rates. The objective of the study is to find out the factors affecting early antenatal booking in Ibadan, Oyo State, Nigeria. Methods. The study was carried out at Antenatal Care Unit, Obstetrics and Gynae of Jericho Nursing Home, Ibadan, Oyo State, southwestern part of Nigeria. This hospital was established in 1927 by the colonial masters, but it was later changed into the hand of top official governments after the independence, and then later by one of the governors in the state, whereby the place is open to all and sundry. The study population in this write-up is this. For the purpose of this study, the sample use consisted of 100 pregnant women, among which were primates. Can you hear me?
Sorry to interrupt. Can I hear you? Please go slowly, and you are moving very fast. We have time. Please
I'm sorry.
Slowly.
I'm sorry. For the purpose of this study, the sample use consisted of 100 pregnant women, among which were primates attending antenatal care at the time of the study. The study design. The study was a qualitative study which was aimed at knowing factors affecting early antenatal booking. The study variables. Information were obtained on the following: antenatal attendance, that is those that booked before 20th week of gestation, and then late antenatal attendance after 20th week of gestation. Then financial constraints, women attitude in taking decision, the level of education, obstetric complications, gestational age of pregnant women, and parity. Parity means number of deliveries. Parity means deliveries. Then the ethical consideration. Ethical clearance was obtained from Ethical Review Committee of Jericho Nursing Home, and verbal consent was taken from all the study participants. Data analysis. Data collected was subjected to descriptive analysis, whereby frequency and percentages were used in analyzing it. Most of the pregnant women were within 24 to 30 years of age. That is 70%, while 30% falls within 31 to 37 years of age. Most of the pregnant women, that is about 80% of them, had tertiary level of education. That shows that most of the pregnant women that came for the antenatal clinic, they were educated people, while 20% had secondary level of education. Findings also reveal that most of the pregnant women were primigravidae, that is 60% of them, while 10% of the pregnant women were gravida 4 para 2 plus 1. That was their fourth pregnancy, while they had 2 deliveries plus 1 abortion. Then 10% of them were gravida 4 para 1 plus 2. That was their fourth pregnancy. They gave to just a delivery, then they had 2 abortions. 10% of them were gravida 3 para 2. That was their third pregnancy, while they had 2 deliveries. Then 10% they were gravida 3 para 1 plus 1. That was their third pregnancy. They had 1 delivery plus 1 abortion. Then 60% of the pregnant women have normal obstetric history, while 40% of the pregnant women had obstetric complication. That is, among those 40%, 10 had cesarean section, 10% had cesarean section, 10% had ectopic pregnancy, while 20% had abortion. The most important reason for not attending early antenatal care was due to financial constraints, that is 40%, while women's attitude in taking decision contributed to 60%. The study found most of the pregnant women are within childbearing age, that is, they have tertiary level of education. Majority are primogravidae, 60% of them. The woman's attitude in taking decision about according to hospital for booking affected early antenatal care. That is, their attitude in taking decisions. Some will say, oh, let me wait till I nearly give birth before attending antenatal. That is the reason why they take that decision, and they didn't know that this decision used to affect them somehow. Therefore, there is need to create awareness and sensitization for pregnant women on the importance of early booking in antenatal clinic. These are the socio-demographic characteristics of women interviewed. You will see that the age of the women is being analyzed there, then the level of education, which the tertiary education took about 30%. The occupation of the women is being analyzed there, the number of previous pregnancies, obstetric history, and reasons for not attending antenatal clinic. That's the pattern of utilizing the antenatal clinic. So, in conclusion, there is need now to create awareness and sensitization for pregnant women in the importance of early booking in antenatal clinic. Thanks for listening.